the goals of care discussions remain an individual clinician's responsibility because, again, our patients, they really don't know how to navigate the system very well, and they really need the experts to kind of actually act as guides and support for them. And if you do this well and you improve on it over the weeks and years of your practice, it really does build trust and good relationships. So when you're having these conversations, you may determine that a particular document needs to come out of it. And then these are advanced care directives. They cover specific scenarios. They're usually part of public policy, right? There are all these rules surrounding how to correctly fill out an advanced directive, how to make it legally binding, how to make a POLST legally binding. So it also needs a system and an infrastructure and legal support. And it's a tangible outcome, right? I could write a note about a goals of care conversation. It has some weight. It has some significance. It matters. But when that patient shows up in the hospital out of it and no one can access my note, it's not as powerful in that scenario.